All right, welcome back to an episode of Podding with PT. I'm Patrick.
And I'm Tyler.
And today we have Rebecca Gasca joining us, a co-worker from Rausch Physical Therapy. Great person to have around, just ask questions to, very knowledgeable. So I'm excited to be able to pick her brain. So right into it. So Rebecca, oh my gosh, my mind is like,
I was like, where's he going?
Yeah. So Rebecca, can you just tell us a little bit about yourself and what you do?
Sure. So let's see. I'll kind of start from the beginning. I'm from Seattle, Washington originally, and then I did my bachelor's in psychology at University of Washington. Then later on went to Pacific University in Oregon to get my doctorate in physical therapy. And then from there moved down to Southern California, where I now practice. And I always knew that I had an interest in orthopedic physical therapy for sure. I was pretty much locked into that. I explored some other settings, but definitely was set on orthopedic therapy. And then I came across a physical therapist in one of my jobs as a PT aide who practiced. It was formerly known as women's health physical therapy, but now it's kind of pelvic health physical therapy because men have pelvic floors too. So now I practice at Rausch Physical Therapy, like Patrick said, and I do I'd probably say it kind of wavers, but 50 to maybe 25% pelvic floor population. And then the other 50 to 75% is the kind of general orthopedic population.
Ah, nice. So how long have you been doing or adding in the pelvic floor therapy?
Since the beginning, actually, which I guess is kind of unique. Although maybe it was unique at the time when I graduated, which was about, I guess, 18, 19, 20, 21, 4 years ago. Not a lot of people were doing it yet. It was kind of something that people would get into like maybe a couple years after practicing, but I knew I was like, the one thing I was able to like predict in my life, like I was like, I knew this is going to be big. So like, I was just going to start, picking up those skills from the beginning. So ever since like day one, like started my first job, I started practicing pelvic floor.
You probably had like a really good head start, because I feel like that's one of those things, like I didn't start thinking that deeply into pelvic floor until like a couple months in, where I was like, and even still, I don't know the knowledge. So I was like, it's pretty interesting. You probably had a good start.
Yeah, I feel very fortunate. I had, that experience before school even. And then I had a professor actually that still practiced while she was teaching, and she was a pelvic floor therapist. And then I got a rotation that was a pelvic floor orthopedic split as my last rotation in school. And then my first job, I actually had like another physical therapist who was like 1 year ahead of me. So then I got to learn from her too.
Oh, wow. Really? So how did you get to Southern California? So it sounds it was in Seattle, then Oregon, and
yeah, just migrating down the coast. It was actually because of my fiance, Jay. We met in school. He's a physical therapist as well at Concentra Urgent Care. He's given the little what in the background over here. And so he was moving back to California after graduation and asked me to go with him. So I was like, hey, why not? Like the, sun sounds nice for once.
oh yeah. Hey, shout out to Jay. I can't see him, but lovely guy. And so did you have your first job in California, or was it in Oregon?
My first job was in California. I actually started at a different company and I only stayed there for about maybe 9 months, 8 months. It just wasn't a good fit. And so I just like knew it in my gut, and I got like my foot in the door with Rausch. At that time, Kevin Rausch was just starting to bring on pelvic floor therapy. So he was looking for experienced PTs to like get that going. So I was kind of one of the first, I guess, to do that at Rausch.
Oh, nice.
So, is there any difference in the way that you treat between, like, say, if you have someone who's coming in for pelvic floor and then just, I guess, a standard like outpatient injury, say like a knee injury, something like that? Do you treat them any differently, or like does that change your approach at all?
Yes and no. I mean, so I don't know how familiar you are. You said you just, or maybe starting to learn more, but the pelvic floor exam is an internal exam. So in that way, it is quite different. But that classic PT answer, it depends. And I think for the most part, like I don't really treat them that differently. Like when I do a pelvic floor exam, it's just like a part of what I would look at if I were to do like a low back or a hip evaluation. It's just like one more piece that I'm looking at. But the one, I guess, major difference I would say is like in the beginning, like the first couple weeks of PT, the progression is a lot slower just because most of the time people have like hypertonic muscles that are causing like pain, or it's like a dysfunctional length tension relationship of the muscle, which is causing them to either, have incontinence, they're, peeing or pooping themselves, or they can't empty enough. They can't like empty their bladder. They can't empty like their colon, things like that. So it takes a little bit of time to kind of normalize those things before I really start giving them any sort of like strength-based exercise. So I just educate people and tell them that the beginning is going to be really slow. It's a lot of patient education. I think probably more patient education than I would with a traditional orthopedic patient. Yeah.
Okay. So in the beginning, you're more focused on like, I guess, relaxing the pelvic floor. I guess it depends, but
yeah, most of the time.
Okay.
Yeah, for sure. Like, what was that?
What was your go-to for exercises for that?
Oh boy. So number one is the reverse kegel, which is like the anti-kegel. It's exactly the opposite. So when we say kegel, we mean like squeeze, right? Like try to prevent a loss of urine. A reverse kegel is the opposite. It's thinking about like bearing down, almost the feeling that you get if you're going to initiate a bowel movement. Or you're trying to empty your bladder. So for women, it's just like, kind of letting the pelvic floor like drop and open. For men, the cue is thinking about clearing the tube, so to speak. And
gotcha. I was like, what does that mean?
You guys both had like the light bulb at the
same
time. When you said reverse kegel, I was just like, how does that
That's
feel?
How I was like, I don't even know what that is, but
yeah, totally. I mean, you could call it reverse kegel, you could call it pelvic drops. I don't know, I'm sure there's like a bunch of other lingo out there, but it's essentially trying to coordinate like your diaphragm with your pelvic floor. A lot of us don't know how to breathe correctly, and even more so in the like pelvic floor population. So it's retraining proper breathing patterns, relaxing or lengthening the pelvic floor, and doing probably some variations of some like hip opening stretches, like child's pose, or like a crossover, like piriformis stretch, happy baby, that's like a yoga pose, butterfly stretches, things like that.
Gotcha. So is gait assessment big into pelvic health?
I think it should be big with anybody for sure. So I don't think it's necessarily I don't think that part's any different than an orthopedic patient.
Gotcha. Okay.
Yeah, and I was thinking like, how is the initial for a pelvic exam? Because I feel like there's so much shame and so much vulnerability that can come with it. It's like, so
Mhm.
how do you try to kind of break down those walls?
Yeah, that's a very good question. I'm glad you asked that, like in that way, because it's so true. Um, Not only taking into that, I guess, with like a typical patient, any kind of patient, right? Like building that like therapeutic alliance. But of course, it's so intimate. So my subjective sometimes will be like, I don't even know, 10, 15, 20 minutes long, just talking, asking questions, getting to know them and their problem. Um, and a lot of that I feel comes with experience to know how to like relate with them or empathize, feel like maybe the attitude, translating back and forth. It's a lot of like nonverbal communication, which is extremely hard to teach, right? Like you just have to do it like a lot and just be patient. Um, there are questions on my questionnaire that kind of give me like a little bit of an insight to maybe they are a little more sensitive or, you know, I don't know if you can necessarily gauge shame, but you can definitely gauge that by body language. Like if they're like feeling kind of like closed off or like looking down or looking away, things like that. I just educate them in the most like, I guess like medical way in terms of like, you know, what the exam's going to look like, why we're doing what we're doing, in light of everything they just told me. So I let them share as much as they want to share. And then I explain what I need to do to help them. And then I use their language, like so motivational interviewing, I use their language to help them understand like how it's going to help and that it's not weird because people do have that sort of like, oh, you're gonna do what, and it's but I just try to let them kind of like feel my energy too, because I will do, like I said, like an orthopedic exam first. Like we'll do like a fully external exam. I'll talk them through range of motion, strength testing, all that basic stuff. They'll get used to like my handling, I think, and like my confidence and like handling their body. Usually, like then it's not a problem to do the internal exam. And I tell them, if you're uncomfortable, like at all, you just let me know. We can stop and come back another day. Sometimes people open up a lot right on the first day. Like they'll be open about maybe some like trauma or abuse. I mean, emotional, physical, sexual, whatever it might be. But sometimes it does kind of come in layers, right? Like peeling back an onion, like with anybody. I've definitely heard some very, I don't even know, shocking things.
Oh my gosh, I could only imagine, because you get really close with a person in general, and then having to go more internal. I was like, I feel like that's a special bond that you have to have with a patient.
Totally. Like it's crazy, but it's just like mind boggling. I mean, it's cool because like I get to help them, but it's also like heavy, which is why I can't do it all the time. That's why I like having my split in my schedule.
I got you. I think it's just huge because so many women, and we've talked about this a little bit before, like don't know after pregnancy, like you should probably go to a pelvic floor therapist. And even more, not even just, or I think you should go to PT in general, but even more specifically, a pelvic floor therapist. And like we then see them like 5, 6 years after pregnancy, like, yeah, I have this like low back pain that came out of nowhere. Well, like it probably happened from like the huge, like 9 month like body swing that you had to go through.
Totally. Yeah. That's huge. That's like probably like, I mean, my favorite part about what I do is that education piece for pregnancy and postpartum. And even like I say prepartum now, like women that are getting ready to like have, a baby or, get pregnant, have a baby. Like it should be a standard, honestly. Like, it just should. So I just tell everybody, I was like, I don't care if you want to listen or not. I'm just planting that seed in your head. Like,
No.
you're going to need it.
So I actually have some questions for you on that. My cousin is about to have a baby. So I suggested it because I don't know who's in her area for a pelvic floor therapist, but are there things in particular for that, like going into pregnancy, that she should know or have any questions about, like asking or common things you get?
Oh, like, you mean just generally from somebody who's
Yeah.
pregnant? I think like exercise is a big one. Like, people don't know like what kind of exercise they should do or if it's safe. And I think you should absolutely check with like your gynecologist or midwife who's ever following you first. Absolutely. Like, if you're high risk, like, you have to follow like the medical advice. But if you're healthy, everything's progressing well, like, you can do like high intensity stuff. You can run, you can jump, you can do whatever, like, as long as it feels good. I mean, really right up into the last like month, 3 weeks maybe.
Wow.
Then it's just really uncomfortable just in general. But
I feel like it'll be pretty wild jumping up with like a,
Just
you know what I mean?
yeah, exactly. Like, at that point, you're just like carrying a beach ball. So,
Jeez. It's crazy
but
to show, like, when I talk to my patients, I was like, your body is strong. Stop thinking that you pulled something. I was like, if someone who is like 7, 8 months pregnant can do high intensity
yeah,
exercise, you can do, you can pick up your pen that you dropped on the floor.
right. It's like, you're fine.
Yeah.
And Rebecca, you do mentorship as well. With
I do. Yeah.
can you speak a little bit about that? Because I know before I got there, you did like a little in service, and I didn't get the pleasure of hearing it.
Yeah. So don't worry, we'll do another one. But so for any like new therapist that is hired, I'll do like a 6 week, I think it's 6 week mentorship, going through just like basic, palpation, anatomy, evaluation, assessment, treatment, like all that kind of stuff. So that's like just step by step, like with the people that are going to be practicing the pelvic therapy. And then for like all of our orthopedic PTs, like, I probably say like once or twice a year, like, we'll do a pelvic in service, I guess, so to speak, just kind of general like knowledge. And for the orthopedic therapist, like signs to look for and how to educate a patient that they suspect has a pelvic floor disorder, and like how to encourage them to get help for it. So the last one I did, it was just me, but I think for the next one, it'll be myself and another pelvic physical therapist, Kristen Nelson. She wants to get in on that.
So you do the mentorship for pelvic floor, and then I just have a question on like the classes themselves. Like, do you help people like go into like the mindset of those? So I feel like even that could be a vulnerable, like going to the classes. I heard you had to get worked on yourself and then work on a partner.
Oh, totally. Which, I mean, in my opinion, like, you shouldn't be allowed to do it unless you've had it done on yourself.
Yeah.
You need to know like how it feels and like, what you're going to be doing. And so, yeah, I actually had to like kind of like coach Kristen up to do her first class. And she was nervous. And I said, okay, like, why are you nervous? And, just like talking with people to see, like, is it something that you're just like you have vulnerability about for some reason, like something happened, or is it just like, different and new? And at the end of the day, like, you just have to rip the Band-Aid off and do it. Like, if you want to practice, like, it's so funny. I told her, I was like, I know it's going to be like weird and like people are going to be all up in your bubble, but like, you'll notice like everybody's going to start the class and like, kind of shimmy out of their pants. And then by the end of it, people literally walking around with no pants. You're just like,
Yeah.
Like, okay,
Yeah.
we're all comfortable here now.
Yeah. And I think that's a big thing just about it itself. It's like, if you have such hesitancy going to the class, like, how could you imagine anybody coming that doesn't even know what you're about to do?
Exactly, especially because it's like it's still becoming common knowledge. It's not like, you're going to a gynecologist, that that's what they do. Pelvic floor therapy is still so new. So it's like, oh, physical therapists are like allowed to do this.
Right.
But
Actually,
it's like,
I applied to Rausch for the so I right when I moved to California, I was applying everywhere, and I
uh-huh.
first saw Rausch Physical Therapy looking for a pelvic therapist, and that's what I applied to first.
No way. What?
Yeah, and then the next day I applied to just I saw another opening on Rausch Physical Therapy as just an orthopedic therapist, and then I applied to that one.
Got it. Got it.
Yeah, and so like because I on the website like there was no experience needed necessary because it was the mentorship and then taking a class, expectation of taking one of those
Yeah.
continuing education courses, and so I was like, then once I got hired as a PT, I was like, I don't know if I want to do this or like, but now after talking to Kristen, I think I'm gonna take a Herman and Wallace course later
That's
this year.
awesome. No, that's so cool. Like, oh my gosh, like I just did a talk for West Coast University, and there was a guy in there that has a pelvic floor rotation coming up, and he like himself like has pelvic floor problems, but has never like been able to like get help for it. And I was like, dude, you're just gonna like change like everything. Like I hope more and more men like start kind of getting into it because it's so needed. Like, and I think we just need to like normalize it. So like I'm with you, man. Like I will help you.
Right. Yeah. And that's what part of it, just like scrolling through Twitter, just seeing other therapists talk about it. And just like how there is a need for pelvic floor therapists. And
Mhm.
then also creating the awareness of there's so many people just living with things that they don't necessarily have to. I was like,
Right.
hey, there's help for that. And so just trying to decrease that stigma of like these are just some of the things you just have to live with. You just deal with it. Like,
Right. It's
and
just
so
like an old person problem. And it's like, no.
It's like, you actually don't have to live with that. Or even thinking of like how many men walk around with prostate problems. Or I was like, you all need to go to PT and get some type of like internal work done. But the problem, I was like, how do you fix the stigma to the stigma? What is the word?
yeah,
Stigma. There we go.
Right. I mean, just talking about it, right? I mean, Patrick, you use that buzzword shame, right? How do you get rid of shame? You bring it out of the dark. You bring it to light. You take away like the power of like not talking about it. You just have to keep talking about it. I think this is like a huge way to do it. So women, we've been doing these things. We've had these problems for, I think forever, especially with pregnancy and postpartum. It's just like women are more likely to have pelvic floor problems, but men do too. So I think like it's really powerful, for man to man, take away that stigma that it's weird for, men to talk about it together. It's, I feel like there's been like a huge shift in the culture of like women, like, lifting up women, like, actually coming together and not like, tearing each other down. But like, I feel like there's been some attention lost like on men too.
yeah, and
So just,
men's health because like
yeah.
I think we're always taught you have to be strong, you have to provide, you have to go to work, and but not a lot on go to the if something feels off, go get it checked out, go to the doctor, even just simple things like go get it checked out. You don't have to wait till you're on your deathbed or just like completely immobilized before you go get help.
Yeah, exactly. Like, I mean, I think it's changing hopefully with like our younger generation. So I mean, kudos to you guys for asking these questions. Like, keep asking the questions and keep talking about it.
How many men do you remind me again? Do you have like male patients?
I don't treat men right now. It's a whole other like separate training to do that. We have one therapist in our Laguna Hills location. She treats males right now. I just haven't done the training.
So because I was looking on the Herman and Wallace website for the different courses, and they had I was wondering what was the difference between like a beginner level course and then they had like a male course as well. I was like, I figured they would have been the same.
I mean, it's just the anatomy is a little different. So
right, and you only have so much time to work through.
And truth of the matter is there are more like gynecologic medical problems than male problems. So we go through like all of those kind of like special topics when we do the women's health section. It's like, the incontinence and the constipation and stuff like that, but it's also endometriosis, polycystic ovarian syndrome, what else? Pelvic congestion syndrome, interstitial cystitis. Like, I mean, there's so many.
The list goes on. Huh?
The list goes on.
Do you like if you're seeing someone for your pelvic floor, maybe they're like a pelvic floor patient, do you, I guess, kind of like finish their plan of care through there and then transfer them to like your outpatient to continue for maybe if they're an athlete or anything like that?
Like if they have like additional like issues.
Yeah, so it's like more, so you took care of like the pelvic floor, but then there were more like orthopedic issues like outside of or external, I would say.
Right. So I think it depends if I feel like the pelvic dysfunction was a part of chronic hip pain or something, like that was like a part of it. Chances are like I probably made a difference in the hip pain whilst or amidst treating the pelvic floor. So in that regard, I wouldn't, because I would just keep it as one case because it's related. But if it's like, for example, like I had a woman with a pelvic floor problem, and then she like also happened to have like an AC fracture, like an old AC fracture, and she like needed help for that. Then I just discharged her from like the pelvic floor and then started on her shoulder.
Okay. Gotcha. Yep. I didn't know if you ever had like an athlete and it was like, okay, they got the basic foundation down and just needed like a better sport, like return to sport type of drills or something like that.
Yeah, I mean, in that sense, like if I have like a runner, pelvic floor problems are super common in runners, then I'll start with them on a running program, because I do see like the typical orthopedic population. Like I've been able to like, train like triathletes and marathon runners. So I'll just keep them on the same plan and then give them more sport specific drills after they're kind of done with the internal part. So it's like I start as internal and then the internal kind of drops off and then I ramp up doing like more sport specific stuff.
Gotcha. Do you have any tips for like daily stuff to do? Like if I wanted to just maybe a general, like a happy baby pose.
Yeah, like if you wanted to be like, just overall like pelvic like wellness.
Yeah. I think I need that. Like add something that add to my daily routine. Yeah, no, I do the thoracic mobility, and you gotta
help Pat out. His back's killing him.
Dude.
Right.
Yeah, so probably a happy baby is a good one. I mean, I think like restorative yoga is amazing for pelvic floor problems. That's something I mean, if somebody wants to do it or is like open to do it, and I'm like, yeah, go for it. But I will kind of just sprinkle in like yoga poses in there. And it's just great for overall like hip opening and like breath work, like awareness. I think anything like that is great. And I think also taking your time on the toilet. It's called a rest room for a reason.
Really? So is there like an optimal time? Because I feel like then people say don't sit too long on the toilet because it could be, was it hemorrhoids?
Oh, yeah. I mean, so in that sense, so if you're gonna go, like, go sit, give yourself a couple minutes, do your thing, take a couple deep breaths. But if you're sitting on the toilet to like poop for more than 10 minutes, it's just not gonna happen. Don't force it. Get up and move on with your day.
Right. Yeah, I got the squatty potty.
Yeah.
Look, I got it.
Yep.
Maximum relaxation. You know what I mean? You just gotta don't force it. Let it flow. You know what I mean?
Exactly. Yep.
Oh, question also into the pelvic floor, I guess, curriculum then. Do they talk or do they go into like a nutrition aspect to it?
There's a little bit, yeah. Like I'm pretty sure there's like more nutritional specific classes you could take, but yeah, they touch on it for sure, especially with like urinary urgency and like interstitial cystitis. That's like a big part of it.
What is interstitial cystitis? What was it?
Yeah, cystitis. It's
Just
like inflammation of the bladder lining. Like,
okay.
they call it painful bladder syndrome, is like kind of the layman's term.
To pivot a little bit, and so Rebecca took the IPA course with me, and just going through, first of all, just learning more about like the superficial fascia and just like how to treat that. What are some of the biggest takeaways from just overall from the course?
For me,
Yeah.
I mean, I guess just like everything's related. I'll just reinforce that. But just how just the lightest like pressure or like manipulation makes a difference. So it's like, I mean, if I need to like go deep into the tissue, like I don't have a problem doing that, but it was also like eye-opening to see like, wow, like I don't have to kill myself to make a change in somebody. And to know like, when patients say like, I don't know, like, oh, you touched my like, I don't know, thigh or my quad and I feel it in my elbow or something weird. And you're like, that makes no sense. But we know now, right, that fascia has like 6 times more nerve endings than muscle. And it's like, a hugely nervous system structure. There's that like myofascial pain syndrome. Like we need to be like aware of that. It's just kind of like a vague, like you can't really, there's no pattern. You just kind of have to like listen to your patient and think through the anatomy. Like, okay, like if I pulled here, like, in this string, it's going to affect here, here, and here.
I thought,
Pulling a China shop over here. Sorry.
No, Pat was telling me about it too, because interesting. I took the course fascial manipulation, and that one also affects the superficial fascia, but it's done in a more aggressive way. So it's super painful because of the nerve fibers. So it's like it's the same, like you're on the superficial fascia, so it's light pressure, but because I don't know if it's the way that you move the tissues or how fast you do it, makes it a lot more painful. Whereas you guys do the same thing, but it doesn't hurt at all.
Yeah, it's just very like slow, and for me, just practicing during the course, it felt like I wasn't doing anything because I'm so used to like just working deep into the tissue, working it, and then just doing some light touch over the body. It's just like, is this it? But I know you felt it a lot more than I did.
Yeah.
Yeah, because you experienced like the electrical feeling. You had an electrical feeling come over you.
Yeah, it was so weird. I was like, what the heck? Like,
what happened?
It was like doing like the superficial fascia, like on my back. Like it was because it was kind of like just like a slow glide along the tissue. And I felt like it's hard to, I guess, kind of like that pins and needles, like buzzy feeling you get if, like a body part's just waking up from like falling asleep. And I felt it just just like a soft like radiation, but like up and down my back from like the places where like Kristen's hand was on my back. And I was like, that's so weird. Like she's not even doing anything.
I have a question for you because you just reminded me of this, and to make myself a little vulnerable. Now, I have a spot in my back that I think it's probably around like my 11th or 10th rib, that if I lay on it and breathe really slow, like on a foam roller, I feel like electrical down to my pelvic floor. I don't know what, it doesn't feel bad. It feels like a cooling sensation.
Interesting.
That's a little scary when you say interesting, but
Just like that's, I mean, it's just cool. Like, I mean, I'm sure that you probably have some stuff then in your pelvic floor.
I know, I was like, damn, because it feels like it just relaxes my whole body, but I don't know what it is.
It's probably a restriction through like the bony contours like of your ribs and then like into the diaphragm. So
Okay.
yeah, like the diaphragm is like the roof of your core and the pelvic floor is the floor of your core. And they, I don't know if you remember like that analogy, like they function like a piston. So that's probably why there's some sort of restriction there.
Yeah, interesting. Because it gets better. Obviously, it gets better when I breathe. So I had a feeling like it was something with my diaphragm, but it doesn't affect me all the time. I have to get it like just right and breathe a certain way, and then it happens.
Got it. So it's never been able to like go away though from that?
Some of the time. So like it's not very, I only notice it if I sit for very long periods of time. Like I have to be sitting for like 3-4 hours and then I'll feel it.
Oh, okay. Gotcha. You should try some of that stuff on him, Patrick.
Oh, yeah. Go ahead.
Yeah. Gotta practice it. I was after the first day, I was like, what are we learning? And it was just because it's just everything that they taught was different than kind of what I'm used to.
Yeah.
And I think it's a good thing to like you're taking some of these things just to like shake up your beliefs, change your perspective, and really just like kind of put yourself out there. But I feel like I just take bits and pieces from it because it's I feel like working superficially very light. Some of my patients would be like, what are you doing? Like,
Yeah.
like my neck hurts. Why are you working on my low back? That type of
No,
thing.
totally.
Right.
I've been doing that with, select patients. Like I have this one patient, for example, she's had like chronic neck pain for like, I don't even know how long, like years probably. And she's got degeneration and all this stuff, but she's like very active. She's pretty healthy. And I know she does everything I tell her to do. So I'm like, why is she still having this pain? Like, can I change it? Like, or is that just her bony structure now? And so I had already seen, well, she was actually somebody else's patient that I inherited, another therapist that had left. And so she was already, I think, like, I don't know, 15 visits in or something, and had gotten like a little bit better. I had treated her for like another 10 and it was a little better. So I was like, I know she likes Rausch. She's been to Rausch for like other things. And so I was like, well, might as well try some of this stuff on her. I know her posture is like totally wacky. She's like that person that has like the typical like accentuated cervical lordosis, accentuated thoracic kyphosis, and accentuated lumbar lordosis. So I kind of broke it up in sections, and I checked her motion and I explained like, okay, I'm going to touch your back. We're just going to see if it does anything to your neck. And just weird. Like, I don't know. It's weird, but it works.
Yeah. It's
yeah, it was
stuff.
super cool. She's like, wow. And then she came back and she's like, I can't believe it. Like, it actually like hasn't come back yet. And I was like, wow.
Oh, me and Pat were talking about that patient language. So it was like, all right, how does it feel? It's like, it's not hurting yet. I'm like, why are you expecting this pain? Like,
I know. And then they're like, I tried to produce it. And I'm like,
Stop. Like, I did this. Like, come on now.
Now you're gonna go
Yeah.
looking for it. No, but at least now during evals, if I hear someone say that, if well, I have one guy in mind. I was doing hip flexion, and he was like, "Yeah, it doesn't hurt yet." And I was like, "Well, we're gonna take it to the in range." I was like, "Does it hurt?" Your leg isn't going any further, so it's like, if this doesn't hurt here, I think it's safe to say you're okay. Like, it's not gonna hurt. It's like, you don't have to like expect pain with every movement.
Right.
So I try to do my best just to work it in. If they say yeah, like, all right, let's take it to the in range. Let's take it, let's push it. And then I was like, does it hurt? And I was like, no. I was like, okay, good.
This is good. Progress.
But the problem, I think, becomes with, and it's so tough because I understand from a patient's perspective, nobody wants to be a science experiment, or at least know that. But like, realistically, all of them are. But
Yeah.
I'm like, if I'm trying something new, have patience with me. It was like, you are a complicated individual. Give me time to try to figure out what's actually going on, so we can decrease the amount of times that you have to come here, and to maybe make sure that this doesn't come back. So I was like, everybody wants, like, hey, my neck hurts, just work on my neck. I was like, these things are a lot more complicated than that. So I was like, give us the time to kind of work through those things. So I was like, if I do pick the superficial fascia on your back, it was like, bear with me. Like, let's have some patience with that. And I was like, I need to figure out a way in which to kind of convey that, I think, a little bit better to patients sometimes.
Yeah. It's just that knowing, like, hey, like, I'm going to try something because of A, B, and C, like, on your body. Like, that's why I'm going this route. Like, and I just tell them, like, I've seen this before, but not exactly like with your presentation. Like, it's a little different. Like, nobody ever is really like a textbook example. So sometimes you gotta try some things.
Yeah.
As being a therapist for 4 years now, when did you kind of feel comfortable treating?
Like, I feel like I could like help like somebody, like anybody.
Well, in the sense, like, I've heard it takes about 2 to 3 years for you to like not feel like a new grad. I was just saying, did you ever have that feeling, or do you still have that feeling as you treat?
I'm trying to think. I mean, the first year was definitely the hardest. Then I feel like I finally felt comfortable and confident, and like 95% of the people that walked in the door, probably after like somewhere in the third year, probably.
Yeah, I feel like this first year has just been punching me some of the times. I'm like, I have this great plan in my head. I was like, all right, I took the eval, I was super detailed. And it's like 3 weeks later, like, yeah, it feels the same. I was like, the exact same. It didn't get even a little bit better. Like, or the worst of the, like, I mean, I think it kind of got a little bit better. I'm like, damn, you're just saying that to make me feel good.
No, totally.
Nowadays, when I hear that, I was like, all right, let's send you back to the doctor. Let's get this checked out. I was like, if it's 3-4 weeks and no change, I was like, all right, hey, there might be something deeper than this.
Yeah.
Like, I am trying, because I find myself like going through all the scenarios in my head, and I'm like, I honestly cannot try anything else. I am working hard, but it's been nice having being at Rausch and like having this open floor and talking to other therapists, because I was like, all right, I'm not crazy here. Like, I am trying.
Yeah.
Oh my God. I had wild story that happened to me on Friday. So I've been treating this lady for her back, and from what I saw, I was like, she did have some problems with like her eyes. So like her balance was off a little bit, and her vestibular system. She had some weakness in her hips, and she had super tight adductors. So I was like, I'd been kind of working through like the hips, the adductors, a little bit on her eyes, and it was getting better. But then she's like, yeah, every once in a while, it still kind of comes back into my low back. So I was like, okay, didn't think much of it. Like, I thought, like, all right, just keep staying the course, because it had decreased the frequency. But then she came in on Friday after she was on vacation. She left feeling good, came back, and she goes, I can't walk. I was like, what the hell? So she comes in at it like 2 hours before her session. She's like, I need you to treat me right now. Like, or I'm going to go to the hospital. Come to find out that she dropped like a lotion bottle on her foot, but she had an old injury from her foot. I think she'd sprained it or fractured it multiple times. And I guess that lotion bottle set it off, because anytime I rubbed near it, she goes, that's my exact back pain. I was like,
What?
damn, that was crazy.
That's
So
wild.
I was like, this is way more complicated every time than I think. So I just sat there like, damn.
It's crazy.
No, for sure.
Yeah. Then she still said, can you treat my back? I was like, I just did this.
It's not your back. No, seriously. Oh my gosh. Like I had this patient, again, someone I inherited. So like I didn't do the eval on these people. And it was just like an older lady, like just like kind of typical seeming like osteoarthritis, like in her knee. And treating, like a little bit better, but then a little worse, a little bit better, a little worse. And it's like, what the heck, man? And then I was like, okay, let's look somewhere else. Like, let's look at the hip, like, let's look at the ankle, right? And her ankle was like super jacked up. And I was like, it's your freaking ankle.
Yeah. Right. Oh my gosh. I've been coming to the conclusion more now, and like more and more as I've been watching people walk without them knowing now. I was like, damn, I miss this in every single time I've watched them walk. I was like, I just needed to not tell them is my problem.
Yeah, for sure. Oh my gosh. And sometimes it's like you literally have to look so far away, like I mean toe or foot or whatever, and like the back, you have to look so far away. You're like, okay, there was just no way like I was gonna see that unless this happened.
Yeah, I was like, I'm convinced now that everything has come from somebody's foot, because then I watched another dude that has elbow pain. Come to find out, so he's a golfer, and I was like, all right, let me see your setup. And as soon as he did his setup, like one of his feet was always like externally rotated. So like, oh, let me check his hip, and his hip was pure trash. When I looked at it, I was like, that's where I should have looked and not even looked at your elbow.
Right, like he's whiffing his elbow because he can't turn.
Because he can't turn. I was like, damn, it took me like over 2 weeks to even think to look at that.
Hey, you got to it though.
Yeah, better late than never.
That's true.
Exactly.
Yeah, and now just like really, I'm trying to be more aware of full body mobility, and so even during initial evals, I was like, I know you say it's your elbow, but humor me. Let me see how you squat. Let me look at everything. Like, we're just gonna take a whole body approach, and some people appreciate it because they're like, good. I was like, I got a lot of things going on. I was like, all right, we might not be able to address everything you got going on, but we're gonna do a quick assessment of everything so I can get an idea, because I don't want to miss anything, but I'm not trying to get super detailed and like get lost in the weeds. So trying to find that balance is like still I was like, all right.
Yeah, it is. It's a tough balance. I think that was probably, well, just like also like talking to people, like I am the doctor, I'm the professional here, so I'm taking the driver's seat. Like you just got to listen to what I'm telling you. That was like such a hard like point to get to, especially being like so young, right? You're like, oh, like this, older woman or older man, are they going to listen to me? And it's like just having that like confidence going into it. I felt like that's what probably took the longest, if I'm being honest.
I agree 100%, because I feel like a lot of the times I'm like, do you talk to your doctor the same way you talk to me? I was like, would you go to your doctor and be like, why are you checking this? I was like, I feel like I would never go to that level of disrespect, but people do that a lot of the times. They're like, why are you doing this? That has nothing to do with it. I'm like, I didn't know. Why are you coming to me then?
Right? It's like, okay, do you want to, take
right.
a reflex hammer? Like,
I was like, go ahead, do what you've been doing.
Yeah, totally. You're like, do you want help or not?
But do you have any advice for any PT, or maybe even a male PT that wants to go into pelvic floor?
Shadow, for sure. Find somebody you can shadow just to like observe, for one. Because you definitely need to know like what you're getting yourself into. So Let me know, Patrick.
I was about to say, hey, you gonna let me shadow? Look,
Yeah,
I'll come in early.
Yeah, so shadowing and then taking a couple classes, definitely. And I mean, it might be weird, but finding a friend you can practice on.
Yeah, definitely. I'm trying to advance the profession of pelvic floor PT.
We gotta buy some gloves and some slippery stuff.
Yep, pretty much. That's the setup. And some chuck pads, the little heel pads.
Yeah. Like, if you do me, I'll do you. You know what I mean? One of those things.
But yeah, I mean, like, that's how I had Kristen rip the Band-Aid off. I was like, I am your model.
Yeah, right. Because like you have to like open yourself up, like no pun intended. Like you.
Yeah. Mm-hmm. There had to be one of those in there. So good.
Yeah, but Rebecca, also, let me tell you, if no one else makes me feel like I should be better with my diet and my nutrition, it is Rebecca. She has like the most variety when I see to lunches, or to like spicy quinoa salad, to all types of Trader Joe's meals. I was like, I've never seen this before. And like I'm over here like scarfing down some Nerds clusters or some cookies, and she's just like sets like a salad on the desk. I was just like, oh wow. Yeah,
I mean,
crushes
thank you, but I'm not that good.
Gallon of water at work. But how I do want to get into like some of your work life balance, and like how do you maintain, and just like what do you focus on?
Like for myself?
For yourself, yeah.
I think boundaries, number one, more than anything. And not leaving yourself like on the back burner. So like doing something like for yourself every day that like fills you up, like whatever that is. So like for me, it took a long time to get into the habit of meditation first thing in the morning. Like, man, I can't even tell you like just the wonders that it's done for like my stress and anxiety, and like just being present and appreciating like just where I'm at in life for sure. And then exercise, diet and exercise, like trying to, I mean, I'm with you on the Nerds cluster 100%, but like trying to not like have as much like sugar and like processed food, because as I'm getting into my 30s, it just doesn't agree with me as much anymore.
Oh man.
So trying to be healthy in that way, and like, because your body is like, you are what you eat, right? Your body is just, the vessel for your being. You want to like it, you want your outer body to reflect your, inner body or your brain or whatever, however you want to look at it. But so I think that's huge. And then like getting outside, spending time like with my significant other. And I think also, I think that's probably a big thing for me at this point in my life, like as I'm getting married soon. So like talking about the future and getting excited for those things, like to share with somebody else, like that's fun, I think. And knowing that whatever your situation is, like it is what it is in the moment, but knowing that you have the ability to change it if you want. So just doing a lot of like just reading for myself too. I think that helps. Yeah, I don't know. That's where I'm at right now. I like to travel a bunch too, but that's been obviously not happening the last couple years.
So what are some of the books that you're reading or that read in the recent?
Okay, so let's see, what am I reading right now? There's this book I'm reading right now called Change Your World by John Maxwell. If you don't know, do you guys know who John Maxwell is? Okay, do that. Look him up. He's amazing. He's like the number one like leadership, like personal development author, like ever. He's like in his 70s now, I think. But he's like so youthful, like you wouldn't even know. So I love him. I read like a ton of books by him. There's one by him called Failing Forward, is awesome. It helps you get over your fear of failing. That was like always a thing for me. Like I was always like perfectionist, like, straight A, like all my ducks have to be in a row. And when I would, when life would like throw me a curveball, I'd be like, oh, the world is ending. So that was a really good one. And then I think for people skills, the Bible is How to Win Friends and Influence People by Dale Carnegie.
I downloaded that book on Audible. I think it was free. But I
read it. Yeah.
But I never read it or never listened to it.
So good. I read it like 2 or 3 times.
Is it short?
No, it's like, I don't know, 200 or 300 pages.
I'm trying to think. Because I had read one of them. It wasn't on Audible, so I don't know how many pages it was, but it was pretty short. Something about winning friends, and I don't know if it was the same one.
Okay. I don't know. There's probably like a bunch of other like books out there too, but this one, it's kind of, I don't know. It's an old book, so it's not split up very nicely. The chapters are like decent sized.
All right. Well, thank you, Rebecca. Is there any questions that you have, Tyler?
No, I think you answered mine. Thank you for taking the time to come on, like especially just clear up some more stuff about pelvic floor. I'm trying to get more just information on it.
Any closing remarks, Miss Gasca, Dr. Gasca?
Just thank you guys for having me. That was like super cool. I was like, you want me on your podcast? Like, oh my gosh. I was like, that's crazy. So it was super fun, and I was glad to do it. So yeah, I hope it was helpful.
All right, thank you.